everyone. Have you ever wondered why one moment your heart beats perfectly fine, and the next, it could be fighting for its life? Why something as small as a blood clot could change everything in just minutes? Today, we're diving deep into the silent dangers that grow inside us as we age. 9 heart diseases you must know, and how they could change your life forever. Are you ready to uncover the secrets hidden within your own heart? Angina pectoris, a warning sign from the heart. What is angina pectoris? Angina pectoris is a symptom caused by a temporary lack of oxygen-rich blood to the heart muscle, usually due to narrowed coronary arteries. It is not a disease itself, but rather a signal that the heart is under strain and not receiving enough oxygen when it needs more, such as during physical exertion, stress, or after a heavy meal. Mechanism of disease. As people age, their blood vessels gradually lose elasticity and become narrowed by a buildup of plaque, cholesterol, fat, and calcium. This limits blood flow through the coronary arteries. When the heart demands more oxygen and blood flow cannot keep up, angina occurs. Typical symptoms: central chest pain or tightness, often described as squeezing, heaviness, or burning. Pain radiating to the jaw, neck, shoulder, or left arm. Lasts around 2 to 5 minutes, typically relieved by rest or sublingual nitroglycerin. May be accompanied by shortness of breath, nausea, cold sweats, or palpitations. Types of angina. Stable angina occurs predictably with exertion, relieved by rest. Unstable angina occurs unpredictably, even at rest, more dangerous, may lead to myocardial infarction. Variant: Prinzmetal's angina, caused by coronary artery spasms, often during the night or early morning. Why it's dangerous: angina is often the first sign of coronary artery disease. Without treatment, it may progress to myocardial infarction, heart attack, or sudden cardiac death. Treatment: lifestyle changes, low-fat diet, smoking cessation, control of diabetes and blood pressure. Medications: nitroglycerin, beta blockers, aspirin, statins. In severe cases, coronary angioplasty or bypass surgery. Bottom line: angina is a request for help from the heart. When oxygen demand exceeds supply, even briefly, it's the body's way of saying, something is wrong. Recognizing and responding early can save a life. Now that we have a clear understanding of angina, we will move on to the next section. Atherosclerosis, the silent narrowing of blood flow. What is atherosclerosis? Atherosclerosis is a chronic condition in which plaque gradually builds up inside the arteries, causing them to become narrowed, hardened, and less elastic. These plaques are made up of fat, cholesterol, calcium, and cellular waste products. Over time, this narrowing reduces or blocks blood flow to vital organs, such as the heart, brain, or limbs. It is the leading underlying cause of many cardiovascular diseases. Disease progression: 3 stages. 1. Silent phase. No symptoms, plaques are small and do not yet restrict blood flow significantly. 2. Clinical phase. As the narrowing worsens, symptoms of organ ischemia begin, such as chest pain, heart, dizziness, brain, or leg pain when walking. And 3. Complication phase. A plaque ruptures or blocks the artery entirely, leads to heart attack, stroke, or limb ischemia. Mechanism of disease. The inner lining of the artery is injured due to factors like high blood pressure, smoking, diabetes, and high LDL cholesterol. This triggers inflammation and the accumulation of lipids, leading to plaque formation. Eventually, plaques may rupture, causing clot formation and sudden arterial blockage. Symptoms vary by organ involved: heart, angina, chest pain, shortness of breath. Brain, memory problems, dizziness, slurred speech. Limbs, numbness, pain while walking, cold extremities. Kidneys, high blood pressure, reduced kidney function. A 68-year-old man with poorly managed cholesterol presented with mild leg numbness. Doppler ultrasound revealed severe atherosclerosis in his leg arteries, with nearly 90% narrowing. Months later, one of his toes turned black due to lack of blood flow. He required surgical amputation of the toe. He later confessed, "If I had known, I would have changed how I lived long ago." Key takeaway: atherosclerosis is slow, silent, and often unnoticed until serious damage is done. Many patients feel completely fine until they suffer a heart attack, stroke, or critical limb ischemia. Complications: myocardial infarction, ischemic stroke, peripheral artery disease, PAD, limb amputation, chronic kidney disease. Prevention and management: strict control of LDL cholesterol, goal, less than 100 mg per deciliter, less than 70 mg per deciliter for high-risk patients. Heart-healthy diet: low saturated fat, high fiber, more fruits/vegetables. Regular physical activity, at least 150 minutes/week, no smoking. Use of statins, antiplatelet agents, aspirin, under medical supervision. Regular vascular screening, especially in individuals over 55. Bottom line: atherosclerosis narrows life silently by narrowing your blood vessels. Early detection, consistent lifestyle changes, and proactive medical care are key to preventing life-altering complications. Myocardial infarction: when the heart is suddenly starved of oxygen. So what is myocardial infarction, heart attack? Myocardial infarction occurs when blood flow through a coronary artery is completely blocked, depriving part of the heart muscle of oxygen. If not treated promptly, the affected section of the heart suffers irreversible damage or death of tissue. It is considered a medical emergency, and prompt action within the golden window, typically the first 90–120 minutes, significantly improves survival and outcome. How it happens: mechanism. Coronary arteries supply oxygen-rich blood to the heart. When a plaque ruptures inside one of these arteries, the body tries to repair it by forming a blood clot. But this clot can completely block the artery, cutting off blood supply to a portion of the heart. Without oxygen, the affected heart muscle cells begin to die, minute by minute. Classic signs and symptoms: severe chest pain or pressure, often described as crushing or tight. Pain radiating to left shoulder, arm, neck, jaw, or back. Pain lasting more than 15–20 minutes, not relieved by rest or nitroglycerin. Other symptoms: shortness of breath, cold sweat, nausea, lightheadedness, extreme fatigue. Note: in older adults or people with diabetes, symptoms may be atypical, such as unexplained fatigue, weakness, or shortness of breath without obvious chest pain. Why it's dangerous. Every minute of delay causes more heart muscle death. The more extensive the damage, the higher the chance of life-threatening complications or death. A 63-year-old man drove himself to the emergency department complaining of mild chest tightness. He appeared stable, but an immediate ECG revealed a large anterior wall myocardial infarction. Within 20 minutes, he experienced a sudden drop in blood pressure and a dangerous heart rhythm. Emergency defibrillation and stenting saved his life, barely. The cardiology team later emphasized, even mild chest discomfort should never be ignored. Complications of untreated or delayed treatment: life-threatening arrhythmias, ventricular fibrillation, sudden cardiac arrest. Cardiogenic shock, heart unable to pump blood to vital organs. Heart failure. Pericarditis, inflammation of the heart lining. Death. Emergency response, what to do: 1. Call emergency services immediately, do not drive yourself. 2. Lie down, keep calm, and avoid any exertion. 3. If prescribed, take aspirin and nitroglycerin while waiting. 4. Go to a hospital with cardiac catheterization capabilities. Treatment options: percutaneous coronary intervention, PCI. Angioplasty and stent placement to open the blocked artery. Thrombolytic therapy. If PCI is not available within the first 2 hours. Supportive care. Oxygen, pain relief, anti-clot medications, beta blockers. Bottom line: myocardial infarction is a race against time. Early recognition and rapid response save heart muscle and lives. If you're unsure whether it's a heart attack, assume it is, and get help fast. Let's now explore next part, a condition so common and insidious that it has earned the nickname the silent killer. Hypertension, the silent threat to the aging heart. What is hypertension? Hypertension, or high blood pressure, is a chronic condition where the force of blood against artery walls remains elevated over time. According to the World Health Organization, WHO, a diagnosis of hypertension is made when systolic pressure greater than or equal to 140 millimeters of mercury, or diastolic pressure greater than or equal to 90 millimeters of mercury, on 2 separate readings on different days. Why it matters: when blood pressure stays high for extended periods, it damages the arteries, causes the heart to work harder, and contributes to a wide range of cardiovascular, brain, and kidney complications. Why older adults are at higher risk: loss of arterial elasticity with age. Long-term lifestyle factors: high salt intake, lack of exercise. Coexisting chronic diseases like diabetes, atherosclerosis. Certain medications or hormonal changes. Family history and genetics. Common symptoms: if any, most people with hypertension feel no symptoms at all, which makes the condition especially dangerous. It is often discovered incidentally during a routine checkup. However, some may occasionally experience headaches, especially in the morning, dizziness or lightheadedness, fatigue or weakness, blurred vision, palpitations or chest discomfort. Why it's called the silent killer? Because it can cause serious, even fatal damage without any obvious warning signs until it's too late. Untreated high blood pressure is a leading cause of heart attacks, strokes, heart failure, kidney failure, and blindness. A 70-year-old woman came to the clinic for a checkup. She looked well, said she felt fine, and only occasionally had mild headaches. Her blood pressure was 175/95 mmHg. When asked, she replied, "Yes, they told me it was high before, but I didn't feel anything unusual, so I didn't take any medication." After a long conversation, she agreed to start treatment. 2 years later, she continues to live actively, her blood pressure well controlled. A simple choice to act early likely saved her from a stroke. Complications of poorly controlled hypertension, stroke, both ischemic and hemorrhagic. Heart failure, due to chronic overload. Coronary artery disease and myocardial infarction. Chronic kidney disease. Aneurysm formation and rupture. Retinopathy and visual loss. Treatment strategy. Managing hypertension is a lifelong commitment that requires both lifestyle changes and, often, medication. Lifestyle adjustments: reduce salt intake, less than 5 g/day. Eat a balanced diet, low in saturated fat, rich in vegetables and whole grains. Maintain a healthy weight. Exercise regularly, e.g., brisk walking 30 minutes/day. Quit smoking and limit alcohol. Practice stress management and adequate sleep. Medications, as prescribed: ACE inhibitors/ARBs. Calcium channel blockers. Diuretics. Beta blockers. Combination therapy, tailored by your physician. Key points in treatment: never stop medication without consulting a doctor, even if you feel fine. Home monitoring is helpful, measure 3-4 times per week. Periodic lab tests to monitor kidney function, potassium, and lipids. Bottom line, hypertension is not a condition to be felt, but one to be measured and managed proactively. You might not notice the damage today, but it accumulates silently until the moment it strikes. The most important thing is, measure your blood pressure regularly, treat it properly, don't give up halfway. Don't let "I'm healthy so I probably don't need it" become a late statement. Okay, next we will learn about the disease, stroke, cerebrovascular accident, the most serious consequence of high blood pressure, and atherosclerosis. So, what is a stroke? A stroke, also known as a cerebrovascular accident, CVA, occurs when the brain's blood supply is suddenly cut off, either due to a blocked artery, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. Without blood, the brain tissue is deprived of oxygen and nutrients, and cells begin to die within minutes. Types of stroke: 1. Ischemic stroke is almost equal to 85% of cases. O, caused by a blood clot or plaque obstructing blood flow to the brain. O, often related to atherosclerosis, atrial fibrillation, or hypertension. 2. Hemorrhagic stroke is almost equal to 15% of cases. O, caused by a rupture of a weakened blood vessel in the brain. O, commonly due to chronic high blood pressure or aneurysm. Why it's an emergency: brain cells begin dying within minutes after blood flow stops. The longer the delay in treatment, the greater the risk of permanent disability or death. Fast action is vital. Recognizing a stroke: the FAST test. Use the acronym FAST to spot signs of a stroke. F. Face drooping. One side of the face droops or feels numb. A. Arm weakness. Sudden weakness or numbness in one arm. S. Speech difficulty. Slurred speech. Inability to speak or understand. T. Time to call emergency services. Immediate action is critical. Golden window. Stroke treatment is most effective within 4.5 hours of symptom onset. Beyond this time frame, options become limited, and brain damage worsens. Symptoms to watch for: sudden numbness or weakness, especially on one side of the body. Difficulty speaking or understanding speech. Sudden confusion, dizziness, or loss of balance. Severe headache with no known cause. Vision problems in one or both eyes. A 72-year-old man suddenly dropped his spoon at the dinner table, with a slurred voice and sagging on one side of his face. His family thought it was fatigue and waited a few hours before seeking help. By the time he arrived at the hospital, over 6 hours had passed, beyond the treatment window for thrombolytic therapy. He survived, but with permanent weakness on one side and impaired speech. His daughter later said, "We didn't know it was a stroke, we thought he was just tired." Complications of stroke: partial or complete paralysis. Difficulty speaking, swallowing, or understanding language. Cognitive impairment or memory loss. Depression, emotional changes. Increased risk of future strokes or cardiovascular events. In severe cases, coma or death. Risk factors: uncontrolled hypertension, atrial fibrillation and other heart rhythm disorders. Smoking, diabetes, high cholesterol. Family history of stroke. Sedentary lifestyle and obesity. Emergency treatment: thrombolytic therapy, clot-busting drugs for ischemic stroke, ideally within 4.5 hours. Mechanical thrombectomy, removal of large clots via catheter, up to 24 hours in select cases. Supportive care, stabilizing vital signs, oxygen, for fluids. Surgery, in some hemorrhagic strokes to relieve pressure or remove blood. Recovery and rehabilitation, physical therapy, speech therapy, occupational therapy, psychological support, and stroke education. Medication to prevent recurrence: blood thinners, statins, antihypertensives. Prevention: strict blood pressure control. Management of atrial fibrillation, anticoagulants. Healthy diet and regular exercise. Smoking cessation and alcohol moderation. Regular health screenings and early treatment of risk factors. Bottom line, a stroke is not just an event, it is a life-altering condition that can leave lasting impairments. But with rapid recognition and immediate treatment, lives can be saved and functions preserved. Knowing the signs could mean the difference between recovery and tragedy. One condition that people often overlook and underestimate until it becomes life-threatening: arrhythmia, when the heartbeat gets out of sync. Cardiac arrhythmia, when the heart loses its rhythm. What is a cardiac arrhythmia? Cardiac arrhythmia is a condition in which the heart beats too quickly, too slowly, or irregularly, due to disturbances in the heart's electrical conduction system. The heart has its own built-in pacemaker system that controls the rate and rhythm of each heartbeat. When this system malfunctions, the resulting irregularity in heartbeat can range from harmless to potentially fatal. Types of arrhythmias. 1. Tachycardia. Heart rate exceeds 100 beats per minute. Examples: atrial fibrillation, atrial flutter, ventricular tachycardia. 2. Bradycardia. Heart rate falls below 60 beats per minute, often due to aging or conduction block. 3. Irregular rhythm. Heartbeat pattern is inconsistent. Atrial fibrillation is the most common type, especially in older adults. Why arrhythmia is dangerous. It can cause the heart to pump inefficiently, reducing blood supply to the brain and body. Certain types, like ventricular fibrillation, can lead to sudden cardiac arrest within minutes. Atrial fibrillation, if untreated, can form clots in the heart. Stroke. Common symptoms: palpitations or sensation of fluttering, irregular or forceful heartbeat, fatigue or weakness, dizziness or lightheadedness, fainting, syncope, chest discomfort or shortness of breath. In older adults, even mild symptoms should prompt medical evaluation, especially in those with underlying heart disease or stroke history. A seemingly simple fainting case that almost killed her. A 66-year-old woman collapsed while watering her garden. Her family assumed it was dehydration. At the ER, her heart rate was only 38 BPM. She was diagnosed with complete heart block, where electrical signals from the atria could not reach the ventricles. A temporary pacemaker was inserted within minutes, followed by a permanent pacemaker a few days later. Without it, she could have died from sudden cardiac arrest. Major complications of arrhythmia: sudden cardiac death, ventricular fibrillation, ischemic stroke, especially from atrial fibrillation, heart failure from chronic fast or irregular rhythms, syncope-related injuries, falls, head trauma. Causes of arrhythmia: coronary artery disease, previous heart attack, high blood pressure, electrolyte imbalances, low potassium, magnesium, heart valve disease, aging-related degeneration of the conduction system, side effects from medications or stimulants, chronic lung diseases, e.g., COPD. Diagnosis and monitoring: electrocardiogram, ECG or EKG, Holter monitor, 24/72-hour continuous ECG recording, echocardiogram to evaluate heart structure and function, electrophysiologist study in complex cases. Treatment options: lifestyle modifications, avoiding caffeine, alcohol, smoking. Medications: antiarrhythmic drugs, beta blockers, calcium channel blockers, anticoagulants. Pacemaker implantation for bradycardia or heart block. Implantable cardioverter defibrillator, ICD for high-risk ventricular arrhythmias. Catheter ablation, minimally invasive procedure to destroy abnormal electrical pathways. Prevention and long-term care. Manage underlying heart conditions, hypertension, CAD, valve disease. Regular checkups, especially after age 60. Monitor for signs of stroke and atrial fibrillation. Adherence to prescribed medications, especially blood thinners if needed. Bottom line: cardiac arrhythmias may seem benign in the early stages, but they can lead to serious, even fatal complications if ignored. Timely diagnosis, proper monitoring, and targeted treatment can restore rhythm and preserve life. Now let's continue with covers a lesser-known but highly impactful condition, especially in elderly patients with chronic lung disease. This is where lung damage leads to heart failure on the right side of the heart. COR pulmonale. When lung disease wears down the heart. What is COR pulmonale? COR pulmonale is a condition where the right side of the heart becomes enlarged and weakened due to chronic high blood pressure in the pulmonary arteries, the vessels that carry blood from the heart to the lungs. It is a form of right-sided heart failure, caused not by a primary heart issue, but by chronic lung disease that increases the workload on the heart over time. How it develops. 1. Chronic lung disease, like COPD or chronic bronchitis, reduces oxygen levels in the blood. 2. This causes pulmonary arteries to constrict, increasing blood pressure in the lungs. 3. The right ventricle must pump harder to push blood into the lungs. 4. Over time, the right side of the heart becomes enlarged, thickened, then weakened. Heart failure. Common underlying causes. Chronic obstructive pulmonary disease, COPD. Long-standing bronchial asthma. Interstitial lung disease. Pulmonary fibrosis. Sleep apnea, untreated. Chronic smoking history. Early signs and symptoms, often subtle. Shortness of breath during physical activity. Chronic cough, with or without sputum. General fatigue or weakness. Lightheadedness or mild chest discomfort. Advanced symptoms. Swelling in the feet and ankles, peripheral edema. Abdominal bloating or fullness, due to liver congestion. Bluish lips or fingers, cyanosis. Prominent neck veins, jugular vein distension. Increased fatigue even at rest. A 65-year-old retired driver, with a 40-year history of smoking and frequent coughing, came to the clinic complaining of fatigue and leg swelling. He thought it was just slowing down with age. Exams revealed chronic hypoxia and an enlarged right ventricle on echocardiogram. A classic case of cor pulmonale, secondary to undiagnosed advanced COPD. He was placed on oxygen therapy, diuretics, and a bronchodilator regimen. His symptoms improved, but only after significant, likely irreversible damage had occurred. Complications if untreated. Progressive right-sided heart failure. Severe fluid retention, legs, abdomen, lungs. Increased risk of pulmonary embolism. Reduced quality of life and mobility. Increased mortality with respiratory infections. Diagnosis. Chest X-ray. Enlarged heart, prominent pulmonary arteries. Echocardiogram. Right ventricular enlargement. Pulmonary function tests, PFTs. Arterial blood gases, ABG, to assess oxygen levels. CT scan or V/Q scan if pulmonary embolism is suspected. Treatment approach. 1. Treat underlying lung disease. Bronchodilators, corticosteroids, inhaled or oral. Pulmonary rehabilitation. Smoking cessation. 2. Oxygen therapy, long-term, for patients with chronic low oxygen levels. 3. Diuretics. To manage fluid overload. 4. Vasodilators or medications to reduce pulmonary pressure in select cases. 5. Monitor and manage heart failure symptoms carefully. Prevention strategies. Stop smoking completely. Early and aggressive management of COPD or asthma. Get vaccinated, influenza, pneumococcal. Avoid exposure to pollutants and respiratory infections. Regular checkups with both pulmonologist and cardiologist for high-risk patients. Bottom line. Cor pulmonale is a heart condition caused by lung failure. It can creep up silently over years of unrecognized or untreated respiratory disease. Recognizing chronic cough, breathlessness, or fatigue as early signs of something deeper can help preserve both lung and heart function before it's too late. So we have had an in-depth analysis of
along
7
with
cardiovascular diseases that the elderly often encounter, and suggestions for effective and easy-to-do home exercises. We will continue to provide more knowledge about cardiovascular diseases that the elderly often encounter, along with suggestions for food groups that the elderly should use, and then suggest effective and easy-to-do exercises. We will continue to accompany you on your health journey in the following videos. Let's go together. Don't forget to subscribe to the channel to follow the values that Health at 60 brings to you. Your health, your legacy.